thank you. As the Mount Horeb community is trying to deal after a number of youth suicides this month, area schools are looking to do more to help kids struggling with mental health.
In any given year, state figures show about 1 in 5 students deal with an issue relating to their mental health, and approximately 4 in 5 who do never receive help. News 3's Madalyn O'Neill has more.
Charlotte and Eric, today the Wisconsin Department of Public Instruction is announcing more than $3 million worth of mental health services grants for 64 school districts in the area. But those with DPI say that amount doesn't come close to covering the need in the state.
I think there's a part of it that feels overwhelming.
While students deal with things like depression and anxiety, it's the space they're in nearly every day where they're most likely to get help.
It can be isolating for our children and youth, and many times schools are one of the few places where they're accepted.
As survey results show, depressive symptoms and suicidal thoughts on the rise amongst Wisconsin students. School districts like Madison Metro are adding more mental health services, like incorporating licensed clinicians.
Treatment and response really makes a difference, particularly when we think around suicide, creating the space where a young person can be open about how they're feeling, can really change the trajectory as to where that child could go.
Madison is one of dozens of districts across the state receiving a grant for mental health initiatives from the Wisconsin Department of Public Instruction. But those with DPI say many schools will be left without a boost.
So we left some people in the lurch, which is not what we wanted.
That's because while about $3 million was set aside for the grants, the department received $8 million worth of requests.
It was very surprising. Yeah, nobody had bad grants. It was just we did not have enough funding to cover all of the requests.
So in the next budget cycle, DPI is asking to increase school mental health funding tenfold, planning to offer more grants and support from parent-peer specialists like Anna Moffitt from Wisconsin Family Ties, who helps parents of students with mental health issues navigate the system.
It's really a challenge for families to access services. It can be really complicated.
The goal is to reach as many schools and students as possible.
We know that the earlier that we intervene, the best it is, again, not only for that student, but for that family, for the classroom, and for the whole school.
Madison Metro's $75,000 grant will go toward expanding a program called Bounce Back for elementary-age students who have experienced trauma. Districts including Stoughton, Sun Prairie, Lodi, and the Partyville area are receiving grant funding as well.
Madalyn, thank you.
There's an increase